Vaccination and Smallpox Mortality. From Public Health Reports, Volume 35, December 10, 1920. This is a LibriVox recording. All LibriVox recordings are in the public domain. For more information or to volunteer, please visit LibriVox.org. Recording by Avai in August 2020. Vaccination and Smallpox Mortality. The following account of a smallpox outbreak in Glasgow, Scotland, is taken from The Medical Officer, London. Early in September, the Medical Officer of Health dealing with smallpox in Glasgow reported that since the outbreak began, 477 patients have been admitted to hospital, 459 from within the city and 18 from adjoining areas. Of the cases, 128 were children under 15 years of age, of whom 98 were unvaccinated, while the remaining 30 had been vaccinated in infancy. Attention is again drawn to the difference in severity of the disease in these two groups, vaccinated and unvaccinated children. None of those who had been vaccinated in infancy have died, while 32 of the unvaccinated died, a death rate among unvaccinated children of 33%. Among the 349 patients in the group aged 15 years and over, 9 were unvaccinated, 6 of whom died. Evidence of previous vaccination was doubtful in 6, 2 of whom died. Of the remaining 334 patients vaccinated in infancy, 54 have died. The relationship between vaccinated state and mortality may be set forth as followed. Vaccinated in infancy. Number of cases, 361. Deaths, 54. Mortality rate, 15%. Unvaccinated. Number of cases, 107. Deaths, 38. Mortality rate, 35%. No definite evidence of successful vaccination. Number of cases, 6. Deaths, 2. Mortality rate, 33%. Total number of cases, 477. Total deaths, 94. Total mortality rate, 20%. The relative excess of mortality among the unvaccinated therefore continues. It may be added that so far no cases have occurred among the medical, nursing, or administrative staff engaged in dealing with patients. Dr. W. McConnell Wanklin, a vigorous anti-smallpox fighter in England, has made exhaustive studies, both clinical and administrative, on smallpox over a long period of time, and the following cardinal principles have dominated his anti-smallpox campaign. 1. Inform the public of the risk they are running. 2. Make the fullest use of routine vaccination. 3. Push vaccination in an outbreak of smallpox and very promptly. And 4. Emphatically let the authorities be constantly on the alert. End of Vaccination and Smallpox Mortality. From Public Health Reports, Volume 35, December 10, 1920.